This is what I've learned about healthcare as a pay-to-play system. There's no universal guarantee. Unlike countries with universal healthcare, the United States ties access to insurance and treatment to employment, income, or private purchase. High upfront costs. Even insured patients face deductibles, co-pays, and co-insurance that can amount to thousands of dollars before coverage takes effect. Emergency care loophole. While hospitals must stabilize you in an emergency, medications, ongoing treatment, and follow-up care are not guaranteed without payment. Medical debt is a barrier to care. Avoidance of treatment. People delay or skip care because they can't afford the bill, turning manageable conditions into fatal ones. Debt spiral. Medical bills are the leading cause of personal bankruptcy in the US, and once in debt, people often ration medications or forego preventive care entirely. Profit incentives over patient outcomes. Means management over healing needs allows hospitals and insurers to often focus on cost control, billing optimization, and shareholder returns rather than holistic patient recovery. Treatment as revenue streams. High margin procedures and chronic disease management are more profitable than prevention or cures, creating a perverse incentive to keep patients in the system rather than out of it. The inequality multiplier. Wealth health gap. Poorer Americans have higher rates of chronic illness, less access to nutritious food, and more exposure to environmental hazards, yet they face the steepest barriers to care. Geographic disparities. Rural and low-income urban areas often have fewer providers. Psychological toll. Stress as a killer. Financial strain itself is linked to higher rates of heart disease, depression, and weakened immune function. The hopelessness loop is when people believe they can't afford to get better without money, so their solution is to stop seeking help altogether. The bigger picture shows us that the American model frames healthcare as an individual responsibility rather than a collective right. That narrative is rooted in market ideology that shapes policy, public opinion, and even personal identity. It's why freedom is often defined as the ability to choose your plan, rather than the assurance that you won't die because you're broke. Health Savings Account, or HSA, is a tax-advantaged savings account designed to help individuals with high-deductible health plans, HDHPs, pay for their qualified medical expenses. It's one of the few financial tools that offers a triple tax benefit, which makes it especially powerful for long-term healthcare planning. Key features of an HSA. Tax-deductible contributions. Money you put into an HSA reduces your taxable income. Tax-free growth. Investments within the HSA grow without being taxed. As long as you use the funds for qualified medical expenses, you won't pay taxes when you withdraw. Who can open an HSA? To be eligible, you must be enrolled in a high-deductible health plan, HDHP. You cannot be enrolled in Medicare, or be claimed as a dependent on someone else's tax return. What can you use it for? Dental, vision, and mental health care. Prescription drugs. Doctor visits. Surgeries. Even some over-the-counter items. Strategic benefits of long-term savings. HSA funds roll over year to year and can be invested like a retirement account. Retirement bridge. After age 65, you can use HSA funds for non-medical expenses too, though those withdrawals are taxed like regular income. Your HSA stays with you even if you change jobs or health plans. HSAs are fascinating. They reflect a uniquely American approach to healthcare by shifting responsibility from institutions to individuals under the guise of empowerment. They're often marketed as tools for financial freedom, but they also assume a level of financial literacy and stability that not everyone has. Now let's talk about staying healthy with Medicaid and Medicare. The reasons poor or working-class Americans may not get the best care under Medicaid or Medicare are rooted in a mix of policy design, provider economics, and systemic bias. Reimbursement rates drive access. Lower payments to providers. Medicaid, and to a lesser extent Medicare, reimburse doctors and hospitals at rates significantly lower than private insurance. The results. Many providers limit the number of Medicaid patients they accept, or avoid them entirely, because the payment often doesn't cover their costs. This creates Medicaid deserts where finding a willing doctor is a challenge. Reimbursement caps. Network limitations. Medicaid networks are often narrow, meaning fewer specialists and facilities are available. In rural or underserved urban areas, the nearest in-network provider might be hours away, making timely care difficult. Even when care is available, wait times can be much longer than for privately insured patients. Currently, there is perception and bias in the healthcare industry. The stigma. Some providers consciously or unconsciously associate Medicaid patients with lower compliance, higher no-show rates, or complex social needs. This can lead to rushed visits, less thorough explanations, or in some cases fewer treatment options offered. Systemic bias. Poor patients may be steered toward cheaper, older treatments rather than cutting-edge therapies, even when the latter might be more effective. Coverage gaps for Medicaid eligibility varies by state. Benefits can be limited, especially for dental, vision, or mental health care. Medicare has notable gaps too. It doesn't cover most long-term care, dental, hearing aids, or certain prescription drugs without supplemental plans. Out-of-pocket costs for uncovered services can still be prohibitive, even with these programs. The U.S. healthcare system rewards volume and profitability, not necessarily quality or prevention. High-end hospitals and specialists often prioritize privately insured patients because they bring in more revenue per visit or procedure. Medicaid and Medicare patients can end up in lower-resourced facilities, which may lack the latest technology or have higher staff turnover. The bigger narrative. From a cultural psychology lens, this is a classic case of structural inequality embedded in a market-based healthcare model. Medicaid and Medicare were designed as safety nets, but in a profit-driven system, safety nets are often treated as minimum viable care, not optimal care. The programs protect people from total financial ruin, but they don't guarantee equal access to the highest quality medicine. So, Medicaid cuts are set to begin in 2027, following the passage of the One Big Beautiful Bill Act in July 2025. This law introduces nearly $1 trillion in federal spending cuts to Medicaid over the next decade. New work requirements for recipients aged 19 to 64, requiring 80 hours a month of qualifying activity to maintain coverage. Stricter eligibility and verification rules could result in up to 15 million people losing coverage. States with high Medicaid enrollment, like California, New York, and Louisiana, will be hit hardest. Some lawmakers are already pushing to reverse these cuts, but as of now, they remain scheduled. This two-tier healthcare reality mirrors the broader American economic structure where public programs provide a floor, but the ceiling is reserved for those who can pay privately. A natural or holistic approach, things like nutrition, movement, stress reduction, herbal remedies, and community-based healing, can be powerful because many of its core elements are low cost or free. But the degree to which it can help someone get well depends on the nature of their illness, their environment, and their ability to sustain these practices. Why a holistic practice can help with healing: low-cost prevention, whole foods, walking, stretching, meditation, and good sleep hygiene can reduce the risk or severity of many chronic conditions, for example, high blood pressure, type 2 diabetes, mild depression. Self-empowerment. People gain agency over their health when they learn skills they can apply without a doctor's prescription, like cooking nutrient-dense meals or practicing breathing exercises. Community resources. Churches, mutual aid groups, and local nonprofits often offer free wellness classes, group exercise, or access to community gardens. Stress reduction. Practices like mindfulness, yoga, or Tai Chi can lower stress hormones, which in turn support immune function and cardiovascular health. The limits in a profit-driven system. Acute and advanced illness. Natural methods can't replace surgery, antibiotics for severe infections, nor advanced cancer treatments. Without access to these, outcomes can be fatal. Food deserts. Many low-income areas lack affordable fresh produce, making eat healthy advice harder to follow. Time poverty. Working multiple jobs or caring for family leaves little time for meal prep, exercise, or rest. Misinformation risk. Without access to reliable guidance, people may try unproven remedies that delay effective treatment. The bigger structural issues we deal with on a daily basis. From a cultural psychology and economic lens, the U.S. system often outsources responsibility for health to the individual, especially the poor, while limiting their access to the very conditions that make holistic health possible. It's a paradox. The narrative says take care of yourself naturally, but the environment, processed food dominance, unsafe neighborhoods, chronic stress from financial insecurity, works against that goal. Practical pathways for those without money. Leverage free public spaces, parks, libraries, for health education, and community centers. Grow something. Even a few herbs or greens in containers can improve nutrition. Peer support. Group exercise or cooking circles reduce isolation and share costs. Bodyweight exercise. No gym needed. Push-ups, squats, walking, and stretching are free. Mind-body practices. Meditation apps with free tiers, or YouTube classes for yoga or Tai Chi. Healthy and nutritious meals on a tight budget prioritize nutrient density. Beans, lentils, oats, brown rice, frozen vegetables, eggs, canned fish, sardines, salmon, seasonal produce. Batch cooking, make large pots of soups or stews to stretch ingredients. Garlic, turmeric, cinnamon, and ginger have anti-inflammatory and immune-supporting properties and may already be in your spice cabinet. Community food sources, food banks, church pantries, community gardens, and gleaning programs. Mind-body practices daily mindfulness, 5 to 15 minutes of stillness, focusing on breath or gratitude. Journaling, track symptoms, moods, and triggers to spot patterns and progress. Community and social health mutual aid networks, exchange skills, meals, or childcare with neighbors. Support groups, many chronic illness or mental health groups meet free in libraries or online. Volunteering, builds purpose, social ties, and sometimes access to resources. When to seek medical care, even without money, holistic care is powerful, but some symptoms require professional help. Sudden chest pain or shortness of breath. High fever that doesn't break. Severe abdominal pain, unexplained weight loss. Signs of infection, redness, swelling, plus mental health crisis or suicidal thoughts. Federally qualified health centers, FQHCs, and free clinics offer sliding scale or no-cost care. Some teaching hospitals provide charity care. The bigger strategy. Think of this as building resilience in layers. 1. Daily habits keep you out of the danger zone. 2. Community connections fill gaps the system leaves. 3. Strategic medical use ensures you don't ignore red flags. The goal: build daily habits that improve energy, lower stress, and strengthen your body, while avoiding the trap of thinking you need to be rich to be healthy. The US healthcare system may be profit-driven, but your daily choices can still move the needle on your health. Think of it as building a protective buffer. The stronger your baseline health, the less often you'll need costly interventions. When you strip away the surface differences, you see systems designed as markets first, safety nets second, and the people last. Healthcare structure: access to quality care is tied to your ability to pay, either through private insurance, out-of-pocket spending, or supplemental coverage. Profit-first dynamic: hospitals, insurers, and pharmaceutical companies operate as for-profit entities, optimizing revenue streams rather than universal access. Two-tier outcomes: wealth buys more personalized care. Access to more advanced and better health options, faster service, and more security. Poverty limits choice and increases vulnerability. Left with minimal or delayed treatments and overpriced medical debts. Individual responsibility over collective provision. The burden is on you to choose wisely and plan ahead, even if structural barriers make that impossible for many. From a cultural psychology perspective, this isn't just economics, it's identity shaping with ever-increasing insurance premiums. Americans are taught to see themselves as self-reliant actors in a for-profit marketplace. Capitalism. Not members of a collective with shared guaranteed health coverage that's free for all Americans. People are sick of being sick. This belief system makes it politically and socially acceptable for essential services to be profit-driven. Even when it means people die earlier, retire poorer, or never reach their true potential without paying the Pied Piper in full. There's a better way to be healthy for us all in the near future.